written?
According to Ollie Cairns, a portfolio manager at Schroeder's Investment Fund, the implementation of commercial robotic surgical devices has increased rapidly in the past decade. Now let's zoom in on the graph.
Yes, so this graph from the same employee at Schroeder's shows that exponential growth between the years 2010 and 2020 for the installment of robotic surgical systems worldwide.
An article written by Sharkey states how that insufficient training with robotics and surgery could actually harm patients rather than benefit them. And in the same article, it's emphasized that they should get anywhere from 15,000 and 20,000 hours of practice with robotics and surgery to fully master it.
Now, obviously, this practice comes from training, and with that training, it is necessary to establish training guidelines. And so those guidelines are really important to protect and benefit all constituents, but above all, surgeons and patients.
According to Cooper, professor at Florida University, argues that not stating and reporting the risk of robotic surgeries from hospitals to the patients is obviously unethical and with the compromising content.
Other researchers at the University of Florida identified 8 different cases where reports to the FDA about adverse events occurring during the use of robotic surgery were reported inaccurately, filed late, or never filed at all.
So, from the Mayo Clinic, the benefits of robotic surgery include fewer complications and better healing and reduced scarring visibly. And then if we zoom in here, we can also see the benefits for surgeons. On the left, we see 4 examples where the degree of difficulty in robotic surgery is lower than that of laparoscopic surgery, an earlier and more traditional method. That data is summarized in the graph on the right. Robot-assisted surgery is many times easier than laparoscopic surgery, and so it would be illogical to eliminate robotic surgery as a whole. It is for that reason we needed to address the problems with other solutions.
So, in an article by researchers at the Royal College of Surgeons of England, they found that robotic surgical simulators could drastically improve the training of surgeons. Now, okay, so this right here is what an average surgeon would see using one of these simulators. This is a virtual reality simulator. And as you can see, the surgeon is performing a surgeon's knot using robotic surgical tools found on the Da Vinci surgical system.
Robotic simulators require hospitals to afford high amount of money. However, through that process, surgeons and doctors can learn specific skills in the surgery collaborating with robotics in certain fields.
Komodo and his team researched and learned that robotic simulations are accurate, they are accurate and have a linear relationship to performance. Gamazi and his team researched and concluded that simulators are accurate, but they are missing some key concepts and components from the real surgery.
Again, there are many advantages for robotic surgeries. However, it still costs $300,000, which is quite a high amount of money for a hospital to afford for one robotics.
Sullins, a professor at Sonoma State University's Department of Philosophy, found that the introduction of robotics in surgery brings a lot of controversy among the public, and that in order for these safer surgeries to be conducted, we have to comfort and inform the public about the benefits of robotic surgery so that they can make an informed consent to have said surgery. We now return to the 8 FDA cases by Alemzada et al., who work at universities in Illinois and MIT. And they found, using the MAUDE database, 8 cases where adverse events in robotic surgery were not reported to the FDA, and there are more details on that available here.
In this chart compiled by the researchers, we can see that 5 of these 8 reports were never actually filed to the FDA. And then the 3 reports that were filed an extremely long time after the actual incident occurred. As you can see in operation number 8, which resulted in death, it wasn't reported until almost 3 years after the original incident occurred.
An article written by Solely about the ethics of robotic surgery state that if a patient is not comfortable undergoing robotics or surgery with robotics, that they have the legal and ethical right to refuse the surgery because at the end of the day it's still their choice.
I think that's mine. Thank you. According to Trout and other researchers at the Heriot-Watt University in the UK, novice surgeons often start their training on virtual reality simulators. But these simulators have one major drawback. When it comes to simulating the interaction of tools with flesh, there is a large amount of discrepancies between what surgeons would view on these simulators and what they would view in actual operations.
These authors also state that there are many limitations for surgeons and doctors to have experience utilizing robotic surgery in hospital due to the fact that it requires hospital to afford a high amount of money.
Now, while there are those drawbacks, it is important to re-emphasize that robotic surgery still has a lot of benefits to many, if not all, constituents. And so that is why our 2 solutions are able to improve the issues that there are. For example, training is necessary. Now that comes with a high cost. What can we do? We can use a simulator to nullify that cost almost. Or we can provide transparency to allow patients to make informed consent to have the surgery. There are options to keep robotic surgery without violating the rights, safety of any constituents.
More about economics aspects. According to Bayes, the associate professor at Paskent University, he stated that average of 11 years of education to become a doctor, it requires $208,000. However, the annual maintenance fees is only $173,000, and due to robotic surgeries, not only hospitals, but also surgeons can get economically benefits from robotic surgery.
This is our next slide. You can stop the timer.
All right, Dylan, can you describe an argument from one of your peers' individual reports that made you think differently about your team's solution or conclusion?
Victor's article made me think a little differently about mine because mine was about health and his was about economics, so I wasn't really thinking about the cost from a different standpoint. I was just more thinking about the benefits on health in general, and I wasn't thinking about how cost can play a factor in robotic surgery.
Okay.
Victor, reflecting on your colleagues' works, which one had the greatest impact on your overall understanding of the problem your group identified?
I think it's Xander's article. I think it was written by Troost. I remember that we actually had a hard time combining all lenses, especially mine is economics, but we were targeting to training parts. But I realized that Xander has many articles related to the economics, so that is most.
All right, let's see, Aidan, can you talk to us about a way in which your team's resolution makes you think differently about your own individual research?
Sure. When researching through the social lens in this topic, what you end up getting a lot of is ethical implications or safety violations. And so each of my team members found benefits while I found drawbacks. So for example, Xander's article by Van Dijk found that these robots can accurately perform the pre-made surgical procedure. We had Victor's article by Bayes, who found the reduced costs for training. We had Dylan's article by Roselle about VR training systems and how that can help implement robotic surgery. And all articles emphasize doing that because of the benefits of robotic surgery. So I was oblivious to the benefits, and it's all free really opened my eyes.
Thank you.
Xander, how did the group decide to include Dylan's perspective lens conclusion into the overall presentation?
The group decided to include Dylan's perspective into the overall presentation by taking a look at the perspective of surgeons more on this topic. In his article by Roussel and other German researchers, it detailed a novel surgical simulator that had a lot of benefits for surgeons. Previously, we hadn't considered the benefits for surgeons, but that does play a big part into this because there are two main constituents in robotic surgery, the surgeons and the patients.
Great, all right, thank you.